Dear students, this video will be helpful for you to learn something about varicella virus complicating pregnancy. To simply put, it is the chicken pox during pregnancy. Myself, Ruth Kesia, Assistant Professor in Triple M College of Nursing. Objectives: we are going to learn about introduction, incidence and prevalence, risk factors, causes, pathophysiology, congenital varicella syndrome, and prevention, management in general, management of prenatal infections, conclusion. Introduction. Varicella zoster virus. Okay, this is the virus that causes this infection, varicella complicating in pregnancy. Okay, varicella zoster virus is a DNA virus from herpes viridae family. It causes a primary infection that is called as varicella. If it is occurs again, reactivation, then it is called as herpes zoster. In pregnancy, the primary infection can lead to maternal and fetal complications. Okay, incidence declining due to vaccination but remains a risk in non-immune women. If the varicella occurs in the childhood days, that is chickenpox, if the comes for a girl child during childhood days, um, she will be immunized for her life. Okay, but if the girl didn't get chickenpox during her childhood days, she has a risk of getting varicella during her pregnancy. So non-human woman. Definition. Varicella complicating pregnancy. VZV infection during pregnancy causes maternal and fetal complications. The forms can be primary varicella, that is chickenpox, and reactivation, that is shingles. Shingles are nothing but vesicle, okay, painful fluid vesicles forming on the lateral side of the body. That is because of the reactivation of the chickenpox. If the chickenpox virus is not killed completely during primary infection and a dormant virus is staying on the skin and that causes reactivation, it causes shingles in a person. Okay. Incidence and prevalence. 1 to 5 cases we can see varicella zoster virus in 10,000 pregnancies. 80 to 90% of the women or child of childbearing age are immune. Higher risk in developing countries. Vertical transmission is less than 2% risk and highest in first and second trimester. This is about the incidence and prevalence. Next, we'll move on to the risk factors. Lack of immunity. What are the risk factors that causes varicella zoster infection? Is lack of immunity, no prior infection and no prior vaccination. Exposure to infected individuals, high risk occupations like teachers and healthcare workers, and immunosuppression, poor access to vaccination. These are the risk factors that causes varicella zoster virus. Causes etiology, the exact causative agent is the varicella zoster virus, that is a DNA virus. Transmission is through airborne droplets or direct contact. Incubation period is 20 to 21 days. Infectious, this pustules becomes infectious 1 to 2 days before rash and until crusting. Okay. This is about the causes and etiology, pathophysiology. Once a virus enters the respiratory mucosa, we saw the virus is transmitted through airborne droplet infection. So once it reaches the respiratory mucosa, the lymphatic replication will occur that causes secondary viremia and skin rash. And pregnancy immunomodulation. Basically, the immune gets suppressed during pregnancy, which worsens this infection if at all occur during pregnancy. And placental transfers occur that leads to congenital varicella syndrome. Okay. Diagnosis, clinical. Okay, fever and a vesicular rash will be there. Dewdrops, just which looks like a dewdrops on a rose petals. If the polymerase chain reaction for varicella zoster virus DNA is positive, then we have to confirm the diagnosis that varicella is present for the pregnant mother. If the serology is done, IgM, if the IgM is positive, it shows acute infection. If only IgG is positive, it shows a previous exposure. Now the mother is immunized. Okay, ultrasound is done to detect any fetal anomalies and early infection, to detect any neonatal congenital varicella syndrome. Okay. Complications in mother: varicella pneumoniae, encephalitis, hepatitis, secondary infections, maternal mortality up to 14% with the pneumonia, and greater morbidity in third trimester. These are the complications in the mother. Complications in the fetus or neonate: if the congenital varicella syndrome occurs during the first trimester, it leads to abortion, which is rare. And if it occurs during the second trimester, that is 13 to 20 weeks, there can be cardiovascular system abnormalities like skin scars, limb hypoplasia, microcephaly. If it is more than during the third trimester, more than 20 weeks, usually subclinical. During delivery, if the complication occurs during delivery, that leads to neonatal varicella, which has up to 30% mortality. If the varicella virus is transferred through the placenta in the utero, then it is called as congenital varicella. If the varicella is the neonates get infected after delivery, then it is called as neonatal varicella. Treatment and management in general, that first will be isolation. So since it is transmitted through airborne droplets, we have to isolate the person, isolate the pregnant woman, and symptomatic care is given. Antiviral drugs like acyclovir 800 milligrams 5 times daily within 24 hours of rash should be given. Hospitalized for severe disease and avoid aspirin. Raise risk means we have to avoid aspirin in any individuals who is recovering from viral infections. Okay, because this combination, the aspirin and the viral infections, antibodies combinations can cause abnormal liver functions and brain swelling. So it is always important to avoid aspirin in case of any individual with viral infections who is getting treatment for viral infections. Management for by trimester: in case of first trimester, check IgG. If the varicella zoster IgG, that is the antibody, if non-human, monitor for CVS. Okay, which means you have to see whether the mother is previously exposed or not. If the IgG is negative, which means the mother is not never had any chickenpox before, then you have to monitor for CVS. The second is serial ultrasound. Okay, during second trimester, you have to give serial ultrasound and amniocentesis if the varicella zoster virus is positive in PCR. And in the third trimester, watch for pneumonia. If peripartum infection occurs, then varicella zoster Ig antibody to neonate should be given plus acyclovir therapy. So basically, if there is peripartum infection, you have to take care of the baby by giving vaccination and acyclovir therapy. Prevention: screening for the immunity before conception, and vaccination before pregnancy. And if at all vaccination is given, you have to avoid conception for 1 month. Post exposure vaccination within 96 hours should be given. And infection control in healthcare. Prognosis: most of the cases fully recover with antivirals. Fetal risk highest at second trimester. Neonatal infection can be fatal if untreated, but it is preventable with vaccine, that is varicella zoster Ig antibody. Summary: this varicella zoster virus complicating pregnancy is rare, but it is a serious complication. Early recognition under antiviral improves outcomes, and prevention via screening and vaccination is the key for this disease condition. So I hope you gain some knowledge about these. Are the references on the varicella zoster complicating pregnancy, and I hope you gain some knowledge about varicella zoster complicating virus. We saw the introduction, definition, the incidence and the prevalence, risk factors, the causative agents, pathophysiology, and diagnosis and treatment, and some trimester wise, okay, treatment and neonatal varicella infection. Okay, thank you all.